Hey, and welcome back. It has been so long since we've last seen each other and since we had the opportunity to actually study together. And I'm just so glad that you are here today. Um, as always, this crash course is being brought to you by LW Pharmacy School. We have kind of done some different things here. We are now LW Educational Services, which means that we have pharmacy tech, but that's one of our many services. And within the pharmacy technician program, we have a 15-week online course and we have a 4-week online refresher course. The 15-week online pharmacy technician course is good for those who are trying to pass the board exam and who needs a background in pharmacy. Maybe you've never worked in a pharmacy, maybe you've never completed a course before. This is something that is brand new to you and you've never done it before, and this is a great program to get your feet wet, to learn what you don't know so you can be successful as a certified technician. I've been a technician for 11 years and it has afforded me an opportunity to work with you. Okay, if you want more information on how to enroll for our 15-week online course, email us at info@lwpschool.com, and that will give you the information you need in order to be successfully enrolled in our program. Okay, so today we are going to talk about medications. This entire video is about to be about medications, and medications is that first topic on your blueprint. And so this entire video is going to cover that. I know that we've talked about this in the past, but for some of my friends, you may not have seen this before, or I keep getting that question. Is this the videos from, that were previously recorded, are they good for 2020? Yes, they are. Everything that I've shared with you since the duration or since the beginning of our channel is all good information. What I want to do now is reiterate what you may not have understood, and just to kind of go over this again with you. So narrow therapeutic index is something that is really new to the PTCB exam, and it's something that you need to know and or be able to talk about if you cannot. Yes, okay. The narrow therapeutic index are drugs that pretty much begin to form some type of dependency on, or not the drug, but the blood forms a dependency on the drug, okay? So it doesn't mean that it's addictive and it doesn't have those addictive qualities like a controlled schedule drug would, but it just basically means that for every day, for the last 15 years, a person may have taken levothyroxine 25 micrograms every day at 1:00 p.m. For the last 15 years, a person may have been taking that drug, right? Let's say something happens like Hurricane Katrina. They can't get to the pharmacy. They don't know, where their medicine is inside the house. Maybe they're on the roof, because a lot of people were on the roof during Hurricane Katrina and they couldn't get to their medicine. So now the body is looking for it and it has become dependent upon it, right? And so at that point, when the body becomes dependent upon medication and it doesn't get it, it can cause serious adverse effects, right? And some of those serious adverse effects could be hospitalization. It could also be, causing a person to possibly, pass away because the body didn't get it. And so narrow therapeutic index is basically when a dose of a medication may lead to blood concentration dependent. It's not the same as being dependent or being addicted to a controlled substance, but it's more so the blood looks for that particular chemical to be produced in the body. And so it depends on it. And when it's not there, then it can have serious adverse effects on that individual. Okay, the most important thing that you want to remember is that warfarin, levothyroxine, all of the drugs that are listed here are considered narrow therapeutic index drugs. And so when you are studying, and this is how I tell my friends to study. Okay, so if you're in my refresher course or if you're taking my pharmacy 15-week online course, you already know because you hear me say this all the time. Make sure that you are focusing in on warfarin, levothyroxine, these drugs that are listed here. And whenever you see them, you want to know what they are, what are they used to treat, and you want to remember that they are narrow therapeutic index drugs, okay? This particular video is going to be completely about medications, in that, you know, the first topic of that's in the blueprint that is worth 40% of the PTCB. That's what this video is going to be about, okay? Now, I'm going to make a part 2 to this video where I'm going to talk a little bit more about medications, but then I'm also going to slide some math in there. But I just wanted to come back and bring some pharmacology to you because we haven't seen each other for so long. And I want to make sure that you understand and you have the meat of the foundation of the test information in you before we start, you know, adding hors d'oeuvres and appetizers and things like that to the plate. Y'all know I like food, so I always relate everything to food. But I want to make sure that you understand what you need to know, because so many people are like, I need to know math. No, what you need to know is medications, because it's worth 40% of your test, okay? And you need to be able to talk about it. Narrow therapeutic is actually listed as 1.8 on your blueprint. And today I got the blueprint with me. Because I want to make sure that I'm referencing it and just kind of sharing that information with you. If you have not liked, subscribed to this channel, or ring the bell, please make sure that you do that right now, because your efforts and your energy of liking and subscribing is what gives me the push that I need in order to continue to bring this content to you. I want to know that what I'm doing matters, and I want to know that you need it. And so the more I see you, you know, chime in and say, hey, Lindsay, you know, when you subscribe or when you like something, you basically saying, hey, and I'm like, hey, friend. Okay, and so make sure that you like, subscribe to the channel, and ring the bell for notifications, okay? Therapeutic equivalence. Talk a little bit about that. And what I did for you, because I like to make things super simple and, you know, make it to where we can all relate to it and that it just makes sense. The short word for therapeutic is therapy. Look at that. See, you knew that already. The short word for equivalence is equal or the same. Come on now. We're not going to make this hard. We're not going to make this hard. We're going to make learning easy, 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 okay? Therapeutic equivalence means that therapy needs to be equal therapy, right? In order for something to be considered therapeutic equivalent, it needs to have the same chemical entity, the same quantity, the same dosage form. All of those attributes need to be the same. Everything that you see right here, okay? I put Aleve, Advil, and Motrin here because if you have a headache, if you have knee pain, if you have back pain, any kind of pain, really, you can take these medications. Some people prefer Motrin, some people prefer Aleve, some people prefer Advil, right? All of this is really personal preference. However, they are all therapeutically equivalent. They are all the therapy. What is it used for? Headaches, backache, right? Some type of pain. So that means that it all has the same clinical or safety, or let me not say clinical profile, but it all has the same or the commonality when it comes to treating something. And it's all used to treat pain. Okay, so that's one. The second thing is that it all has the same dosage form, right? It all has the same dosage form. Now, I'll be honest with you, and please do not shoot the message, and I'm just trying to get this information to you in a way that you can receive it. I did not look at the back of Advil, Aleve, and Motrin to see if it had the same chemical entity. I didn't look to see if it had the same active ingredients. What I did see is that it had the same dosage form, and I did see that it all has the same route of administration, which means that it is oral, okay? Now, I can't tell you what exactly kind of chemicals are in it and all of that. So if you're going to be, you know, trying to pull apart and really zoom in on that, and if you look at those and you start comparing, and you like, well, she said this, and Advil got this, and Aleve got this, and that's what she, look, you're going too far, okay? They do not pay us to have a degree in biology or a degree in chemistry and all that. And see, that's probably a problem anyway. You're digging too deep. Stay surface level with this. Okay, I'm just trying to help you so this stuff can be in your mind, because what is the common goal is to make this easy. That is what I'm here to do, is to make it easy, friend. So look, you may go and look at that stuff and say, oh, Lindsay, you said such and such. You're right. Child, it's just a picture. Okay. But yeah, basically you just want to make sure that it has the same chemical entity, quantity, dosage form, route of administration. Route of admin means that it's oral. They both, all three of these go oral. All of them said, well, I see this one says tablet, and this is an enteric-coated tablet. And so Advil comes coated. So if you've ever put like an Advil in your mouth, in the little brown one, and you know, it tastes like chocolate, they've coated it to make sure that it does not upset the digestive system. Okay, so that's something you can remember from me. But again, you want to make sure that if it is therapeutic equivalent, that it has the same chemicals, same quantity, same dosage form, same route of administration, clinical profile, or clinical effects and safety profile. Dosage forms is something I'm going to put in my next video. So if you don't know what that is, I want you to look out for part 2, because I'm going to talk a little bit about dosage forms, because a lot of you all are getting dosage forms and medication strength confused. Come on, we don't need all that. Okay, drug to disease. So let's talk about the fact that we talk, okay, so on the blueprint, 1.3 underneath medication, it talks about types of interaction. Types of interaction, okay? So we have drug to disease, types of interaction. Drug to disease interaction is an event in which a drug that is intended for a therapeutic use causes some harmful effects in a patient because of the disease or a condition that the patient has. So basically what this is a person may have diabetes, okay? They may have high blood pressure. If a person has diabetes or high blood pressure, they should not be taking pseudoephedrine. Pseudoephedrine is an ingredient that is inside of Sudafed, okay? A lot of times pseudoephedrine is kept behind the counter. It's BTC, behind the counter, not OTC, but BTC. Behind the counter drugs do not require a prescription, but it does require monitoring. Why? Because these drugs have been known to be used to make crystal meth. So whenever you're taking your test and you get a question that says, which drug is considered a part of meth watch? And if you see pseudoephedrine there, then you know that the answer is pseudoephedrine, okay? If you see Sudafed, listen to that, pseudoephedrine, Sudafed. Yes, friend, we're gonna make it easy. Okay, so pseudoephedrine is used to make crystal meth. If a person has high blood pressure or diabetes, they should not be taking Sudafed or anything with pseudoephedrine in it. Drug to disease is anything, any drug that causes a bad interaction with the disease. So if a person has high blood pressure, they take pseudoephedrine, it's going to increase their heart rate, which will increase their blood pressure. It has a negative interaction, okay? Now, you know, if you've studied with me before, you know we've talked about the fact that not every interaction is a bad interaction, right? Remember we've talked about that before, so if you studied with me before, this is not your first time. You know that we've talked about all interactions are not considered negative. You and I are interacting right now and we're having a positive conversation. This is a positive interaction. So whenever you think about interactions, I don't always want you to go to that negative thought. I want you to keep in mind and be very open-minded throughout this process that not everything has a negative impact. If you have not liked, subscribed, and ring the bell for this channel, please make sure you do so at this time, okay? Drug-to-drug interaction. So this is gonna be where the drugs interact with each other. You have addition, antagonism, potentation, synergism. What I want you to do is I want you to think about think about the small word that you see inside of addition. My throat was dry, take another water. Okay, so Addition, the root word of addition is add. So it's going to be when we add two drugs together, and it's that combined effect of two drugs working together. Like I know that they have certain blood pressures where you may have the triamptorine, and then you have the hydrochlorothiazide, which is a fluid pill. Um, and so they are trying to get that fluid off of the body as well as maintaining the blood pressure, right? Um, then you may have the next one is antagonism, right? So an antagonism would be, and just think about somebody that's antagonizing. You know, it's like you are really just doing the most. You are, you know, bothering me. So antagonism is going to be when one drug works against another drug. Potentation. What is the root word of potentation? Potent, strong. Okay, so it says one drug increases or prolong the effects of another drug, right? So I'm sure that if a person takes an anti-anxiety drug, which is used to treat the nervous system, and we know that drugs that are used to treat the nervous system, one of the side effects is drowsiness. It may be cause dizziness, something like that, right? A person takes a Benadryl on top of taking Xanax. Now, this Benadryl may increase the effects of the Xanax, causing the person to feel drowsy longer than they normally would, because the Benadryl side effect is also drowsiness, and Xanax is also drowsiness. And so now, instead of them being drowsy for 6 hours, they may be drowsy for 12. Synergism. It's going to be something where it is a joint action of a drug in which their combined effects is more intense or in longer duration than the sum of the effects of two drugs. Okay, so now we're looking at these two drugs having a longer, more intense. And so, you know, sometimes you may also see where people are taking these drugs once a day, you know, and so now, you know, you may have the two drugs working together and they're allowed to take it once a day because they are working, the drugs are working together, synergism, and it's actually working better for that patient that way, okay? And you want to make sure that you understand these different types of interactions, because these interactions are going to show us why a person may be compliant, why the person may not be compliant, that sort of thing. When we start to look at interactions, you know, the overall goal of pharmacy is to make sure that our patients complete the therapy that they've been assigned by their doctor, physician, whomever, right? And so if there are some interactions happening while that person is taking their medication, they may say, you know what, I don't like the way this makes me feel, so I'm not going to take it. I don't like, you know, what it makes me do, so I'm not taking it, okay? Types of interaction. So you have OTC, where an over-the-counter drug can interact with a prescription drug. You have drug to dietary supplements, where a person may be taking, you know, a prescribed drug, and they could be using vitamin C drops. So the other day I'm using my vitamin C drops because, you know, it's like we're all trying to make sure that we keep our immune system built and things like that, especially during this virus or pandemic. And I realized that the bag said that it's a dietary supplement. I'm like, oh, wow. You know, so this is something to think about. And the flavors that comes with the vitamin C drops is grapefruit, orange, and lemon. And if you know anything about, you know, the dietary or even the nutrition interactions, you will know that grapefruit interacts quite a bit with certain medications. So I thought that was pretty interesting. The next one is drug to nutrition interaction. So nutrition can be food, it can be beverages, again, dietary supplements. When we think about drug to nutrition, so if a person is taking an antibiotic, and let's say flagyl is used for a yeast infection. Person is taking an antibiotic, and they go out to happy hour and they have 2 margaritas. Now, the bottle will tell you do not take or do not consume alcohol while you are on this particular medication. For Flagyl, it can make you sick if you are using alcohol, or for some people, that might be one of the side effects. But the worst thing that happens is it decreases the antibiotic. And so now the person may have been taking this for a particular infection. And so if they're drinking, the antibiotic is not working 100%. And so now the infection lasts longer. And so if the patient was put on the medication for 7 days, they may have to wind up taking it for 14 days because it wasn't taken the right way the first time. Okay. Another one that you can think of is is birth control and antibiotics. So if a person gets on birth control and then they have some type of infection, the doctor prescribes them antibiotics, they always say, hey, make sure you use extra precaution while, using this antibiotic, because they know that it will definitely lessen the effects of, the antibiotic. Sorry, not the antibiotics, the effect of the birth control. So they always say, hey, use extra precaution because it will definitely lessen the effects of the birth control. The last one is drug to laboratory interactions. And basically what those drug to laboratory interactions are is when you see, let's say a person, okay, well, I won't use me, but a person may be pregnant. They go to the doctor to get some tests done, and they always say, hey, you need to fast before you actually get your test done. Or even if you are getting a physical done, right? You're getting some blood work done at the doctor. They always ask you to fast, and they do that not because they don't want you to eat anything, but because they don't want anything showing up in your lab work that can interfere with your actual lab, right? And so then they might think too, oh, okay, well, it may appear that this person has some issues with their kidneys, but really in actuality, they ate something that could have had their kidney levels high or something like that, right? So that's that. You want to think about those type of interactions. And now let's talk about drug stability for a little bit. Drug stability. So when we think about the stability of a drug, we basically want the drug to still have all of the same qualities that it had when it was originally compounded and or performed or made, right? And so you and I, we go to the grocery store, and if we buy some bread, or some chips or something like that, when we bring it home, and if we don't eat it that first day that we buy from the grocery store, maybe we buy it on a Sunday and we eat it on a Friday. We're not expecting for the bread to be molded. We're not expecting for the bread to be molded. We're not expecting for the milk to be sour. We're not expecting for any of that stuff to actually happen, because our expectations are, we bought a product, and by the time we get ready to use it, it better be good and it better look right, okay? So when you think about drug stability, one of the things one of the attributes that shows that a drug is unstable is the physical appearance. So if you think about food, whenever food has gone bad, it always shows itself for the most part. So like bread is molded. The milk may be clammy looking, and it may, look more like cottage cheese. When you think about, let me see, some type of juice, that may have been in the refrigerator for a while, it may lose its original color. That's another one. Also with, microbial growth. So I think about a potato. Like if I don't eat my potatoes right away and they start sprouting, that's growth, right? Because now it's growing and it's gotten pretty bad. Also, the ointment says grittiness. So we know that ointment should be smooth. It should be pretty consistent with the texture. But when, it changes that consistency, it begins to grit up, and it begins to feel like someone put some salt inside of it, or maybe even grits itself might have been placed inside of it too, right? So that's something, that you can kind of think about when you think about drug stability. Drug stability for creams, gels, suppositories, and powders. So this is what a suppository looks like. And normally these are kept in the refrigerator, because the moment that they feel heat, they begin to melt because they think that they are in the body. right? Someone said, there are no powder form drugs. I said, oh, yes, it is. So I had to show you the BC powder. A lot of people use this for hangovers. And then you have the gel. This is used to be prescribed or a prescription drug, but now it actually is over the counter. So anyone can get it, which is probably a cool thing. But when you think about, the drug stability of these drugs, you begin to think, what is something that I can remember about what they should look like, or maybe not so much what they should look like, but more so, how can I realize or maybe identify if the drug is no longer good? Where it's always going to be the appearance, suppositories is always going to be the appearance as well. If it has an odor, so going back to that milk, if I open up the milk and it smells really bad, I pretty much know, oh my God, I can't use it, right? And then too, sometimes if you smell chicken, before you cook it and it has a stench to it, then you know too that that chicken is not, it's not good and it should not be used. Incompatibilities, physical incompatibilities. So we have physical incompatibilities and we have chemical incompatibilities. Now you will notice here that this is a picture of a chemical incompatibility and this is a picture of a physical incompatibility. Physical incompatibilities is going to be something that you can see with the naked eye. So whenever I think about the word incompatibility, I always think about relationships. And I watch Married at First Sight all the time on Lifetime. I love it. And since we've been in quarantine, I've been binge watching. Oh my God, like someone come and take the remote from me right now because I just need to be thrown away, right? Because I get so caught up into these shows. But I like Married at First Sight because it shows how if you have the same values, whether or not you've seen this person or not, you can possibly be compatible with the person that they match you with. Even if you've never seen them the first time, or if you've never seen them at all, the fact that you share the same values and the same belief systems is what could make you compatible. And so sometimes, on the show, you have people who are very, very compatible with each other. And then there are times when they are not so compatible. And those are the ones that I say, oh no, they are incompatible. They don't go together. It doesn't mix well. And whenever I see them, I see couples arguing all the time, or if they can't be, sensitive to each other's needs, or if the person never looks happy, there is an incompatibility that you can see and you can visibly recognize it yourself, right? And that's the same thing with the drugs. You want to remember that physical incompatibility is something that the naked eye can see. So here, it went from clear to a little foggy, and now it's completely, distorted. You're like, yeah, no, I'm not going to drink that, right? Or yeah, no, we're not going to use this, okay? Now, chemical incompatibility is a reaction in which a visible change is not necessarily observed. So I thought about the fact that, when people go out and they hang out with their friends and they, we've heard these stories where people are, what is it? Date rape. I just have to say it, the date rape drug. People are putting stuff in people's drinks. And, you've always been, kind of heard, hey, if you put a drink down, don't go back to it, especially if you're at a bar, don't go back to it because you don't know who could have put something in your drink, so on and so forth. And they say that because if someone puts something in your drink, or in a drink, you're not going to be able to see it. And that's a lot of times why people are, taken advantage of, is because someone buys a drink, somebody slips something in there, it's a chemical mixed with another chemical, and it is not visibly recognized or observed. And so you see here, we have someone dropping something in a drink, and it's happening right now. And the person is probably going to go for their drink, and you're not going to be able to see that those chemicals have been mixed together. And so again, chemical incompatibility is when a reaction in a visible change is not necessarily observed. Okay, so now we are going to talk a little bit about some questions, because it's one thing to show you what to do, but then it's another thing to make sure that you know how to actually do it, okay? So now let's talk a little bit about what you've already learned. It says, which of the following drug interaction is correctly matched to its definition? And if you are in my class, you know that I tell you that the multiple choice answers are here to support you in your question. Yeah, they're here to support you. You also know that I told you on that test, when you get ready to take the test, do the ones you know first, and then come back and do the ones that you don't know. Okay, but make sure you do all the ones that you know first, because we need to build that confidence, and we need to make sure that everything is easy. So what we're going to do is look at these questions and then look at these answers. And it says antagonism is the joint action of a drug in which their combined effects is more intense. Well, remember we said antagonism was against. So we know that's not right. Oh, we skipped this one. Addition, the combined effect of two drugs, it is equally to the sum of the effects of each drug taken alone. Okay, so that means two drugs are working together. Potentation is when one drug works against the action. Well, remember we said potentation means that it's potent, it's strong. So I don't know if that's right. And then synergism is one drug increases or prolongs the effect of another drug. The correct answer here is going to be addition. Addition, right? We have the multiple drugs here, and the addition is the combined effects of two drugs taken together, right? Okay. A patient with glaucoma should not take which OTC drug classification? A patient with glaucoma should not take which OTC drug classification? Is it A, B, C, or D? The correct answer is B. If a person has glaucoma, they should not take antitussives, okay? Which of the following is classified as behind-the-counter decongestants? We just talked about this. Is it A, B, C, or D? Pseudoephedrine. Remember, pseudoephedrine. Any drug with pseudoephedrine is always kept behind the counter, so we can monitor those that particular drug to make sure that it is not being used for anything other than the decongestants, right? Suffixes are often useful in determining the drug class of medication. Which of the following suffixes is correctly matched to its drug class? A, B, C, or D? And the correct answer is A, proton pump inhibitor. Proton pump inhibitor ends in P-R-A-Z-O-L-E. That's going to be important for you to remember, because if you are wrecking your brain trying to remember all top 200 drugs and you're having a hard time, it's because you're not going to remember all top 200 drugs. And we've talked about this before. Suffixes and prefixes is going to be your go-to when it comes to remembering the medication. If you knew that Prilosec and omeprazole, all of those are proton pump inhibitors and they end in P-R-A-Z-O-L-E, which is basically the generic that does, then you would have been able to get this answer correct. But if you pick anything else, you need to tighten up on your suffixes, okay? Tighten up on your suffixes. Which dosage form is described as a solid particle dispersed in a liquid vehicle? That means that it goes in solid, and then the way that it's given to the patient is in the liquid, okay? I told you I'm your friend. I told you I was gonna help you. You thought I was playing. I told you I'm still here. Is it emulsions, gels, lotion, or suspension? The correct answer is D, suspension. Suspension is the liquid or the solid particle that is dispensed in a liquid vehicle and transmitted to that patient, right? What route of administration will provide the highest blood concentration in the shortest time? We know that IVs, intravenous, is the route of administration, which is through the vein, that gets to the patient the quickest and is going to have the highest blood concentration of whatever is injected, because it hits that blood system right away. Which beyond use state should be assigned for a water-containing oral solution stored at controlled cold temperature? Which beyond use date, which means that it's a date that should not, that is put on there to make sure that we don't use it beyond. So it's not an expiration date. A beyond use date is given at the time that the medication is compounded. An expiration date is given at the time the medication is manufactured or is given by the manufacturer, right? So let's think about it like this. When you buy something from the grocery store, you may buy some chicken. Before you cook the chicken, the expiration date may be December 31st, 2020. Okay, just hypothetically. Again, I told you I'll just give you examples, right? But when you cook the chicken today, it's not going to be good until December 31st, 2020. No, because you manipulated it, you compounded, you cooked it. So you have to give it a beyond use date, which means that I cooked it today, then this is going to be good for 2 days or 3 days or whatever the date is you give it. Okay, but the expiration date that was given by the manufacturer was December 31st, 2020. But because you manipulated the chicken and you cooked it, you now have to give it a new beyond use date. You can thank me later. Okay, now when we think about this is oral solution. So I always think about the pink amoxicillin medication that everybody used to get when we were kids, and you put it in the refrigerator, or maybe you gave it to your kids, or maybe you gave it to somebody that you knew. But typically it is 14 days, right? Now, when you take your test, you may see 10, you may see 14. You know, if 14, if that's there, you go with that. If 10 is there, you go with that. It's not 7, it's not 30, and surely it's not 6 months, okay? So you want to make sure that you pick 14. Some people have told me that they saw 10 and they picked 10 and it was right. Some people say they picked 14 and it was wrong. But I'm just going to let you know the book says 14. And that's what we've seen in the pharmacy too. It's typically, you know, we tell them do not use, discard after the 14th day. A patient is taking carbamazepine. Okay, there's that NTI drug. Ding, 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 ding. NTI. I told you, wake up. I told you I was going to help you with this. For seizures, which of the following may increase its effects? Is it dairy, grapefruit, lettuce, or fatty foods? It's grapefruit juice. Oh my God, you are so smart. And I know the pictures here are helping you. Someone told me before, they're like, Lindsay, you just give the answers away. Yes, because everything needs to be easy. Look, life is hard enough. And if you got to come to my channel and learn about pharmacy and I'm making it hard and you walk away feeling defeated and feeling like you can't do it, then I did not do my job as a friend, okay? And so it is absolutely my pleasure to make it easy for you when it comes to pharmacy, because I know how hard life is already. I know that life can be challenging. I know that things are always, you know, feeling like it's time you start something new, then here's something else comes and now you're having to put this on hold because you're trying to deal with that. So me trying to make this hard for you, friend, that's not my job. My job is to make everything easy for you pertaining to pharmacy so you can pass your board exam and become certified. This is why we've created this 4-week online refresher course, because I realize that not every person needs the 15-week online program. Some of you all are already pharmacy technicians operating inside of the pharmacy, and you just need to pass and become certified. Some of you all are trying to keep your jobs, right? And you're trying to become certified because you need to keep your job in order to take care of your family. I get it. I have a family, so I know what it feels like. I want you to know that our 4-week online refresher course is going to teach you exactly what you need to know in order to pass the exam. You will learn exactly what to study. So many of my friends email me and say, Lindsay, I just don't know what to study. Well, this is why we've created this program, because I want you to know exactly what to study. There's nothing wrong, you know, with using YouTube channels and things like that. But if you don't have a source that you pull from, a source that you know works, we have a 90% pass rate. A 90% pass rate. It was 85% when we first started. Now all of our friends, for the most part, are passing on that first time. Now I will be honest with you and tell you, every person who has taken the test with us have passed the test. Okay. Some of our friends have passed it on the first time. Some people needed 2 times. It might have been because of what was going on personally. But the commonality in every person is that they passed the board exam and moved on with their life. I am looking at some of my friends who have been in that same place since the beginning of, or since the conception of this channel last August, and they are still asking the same questions, but they have not enrolled into our refresher course. They've not started the 15-week course. They just want to ask these questions, and I'm like, how long do you want to keep going on? Do something you never did before. Change your life. Change the trajectory of your life. And do something you've never done. Invest in your future. You got it. Look, let me tell you something. If I would have known that I would be today where I am right now, 10 years ago, if somebody would have told me this, I would have been like, no, you're lying. It's not going to happen. But here I am 11 years later, rocking it out as a certified pharmacy technician, being able to work with you all and to live my best life and to be happy and to be in a place where I can now, see financial stability, and I can have those things that I said that I would have at a certain age. I am just grateful that with this opportunity as a certified tech, that I've been able to get everything that was supposed to be for me. I want you to know that you are doing the very best that you can with what you know how to do, which is why it's important for you to enroll, so that way we can help you get to that next level. You know what? For so long, we've talked ourselves out of doing things, and we have, made it seem like stuff is too hard. And that may be true. Maybe sometimes it is hard to do it on your own, but this is why we're here to help you. This is why we're here to support you. Okay. I don't want you to feel like what you've done in the past doesn't work. I don't want you to feel like you have to stop studying. I don't want you to tell yourself, well, I can't do this and I can't do that. All you need to do is continue to put one foot in front of the next, and then the next foot in front of that foot, and to keep pushing through with your dreams and your goals and everything that you have put in front of yourself that you said you were going to obtain in 2020. I know that 2020 has been a year that has shook us up. It's been a year that has tested our faith. It's been a year that may have taken some loved ones. I think that we all have been affected by 2020 in some way, shape, form, or fashion. And this is why it's important for us to stick together. Okay? Hug on yourself, love on yourself, kiss yourself, talk to yourself. I do it all the time. People laugh, but it's what I need from Lindsay. And remind yourself that you are worth it. You are powerful. You are loved. You are supported. You are needed. And I know that together you and I will win this race, okay? There is nothing in this world that you cannot do. There is nothing in this world that you cannot have. You can have what you want if you want it. I want you to continue to encourage yourself. I want you to continue to love on yourself. Don't give out. Don't give up. Don't give in. Do not throw in the towel, because it is not over yet. You are here where you are supposed to be, not by coincidence, but because it is predestined for you to be right here in this moment. Everything that you've done in the past has prepared you for this opportunity. Take it, run with it, use it. It is meant for you. Thank you so much for watching this video today. I absolutely really appreciate you and your time that you give towards me and the time that we share together. Please do not doubt yourself. Don't give up on yourself. You are headed in the right direction. Until next time, take care of yourself, stay healthy, and stay safe. See you again. God bless you.